Do you have chronic kidney disease and wonder what can you take for your allergies? Well, I'm going to talk about that and more coming right up. Hello, Kidney Warriors. James here, your favorite online kidney health coach, bringing you more great information completely free. And today we are talking about allergies. But before we get started, if you have not already done so, click the subscribe button and subscribe to my YouTube channel. And don't forget to click that little bell icon right next to it. That way, every time I upload a brand new video, you'll be one of the first to get notified and have access to this great information. Now, to today's topic, allergies. All right, I'm just like many of you. I suffer from severe seasonal allergies. Also, I'm allergic to cats. Just someone visiting who has a cat, oh, my eyes are swelling, my throat's getting tight, my voice disappears, and I start sneezing like crazy. It gets so bad, I'm embarrassed to be out somewhere. And if it happens at work, oh my goodness, it's so disrupting to other people. And I just can't get my job done. And I'm on the phone most of the time. I don't need to be hitting my cough button constantly and cutting out because I'm sneezing. And people don't want to hear a raspy voice talking to them about stuff. So I rely on allergy medication. And if you've got kidney disease, I know you're worried. What can I take that's safe? Because as you know, every single pill you take, it doesn't matter what it is, multivitamin, allergies, they all travel through your kidneys. And we want that trip to be as pleasant as possible and not do any harm. So first, let's talk about the three types of common allergy medication, or three forms that it comes in. There's nasal sprays, there's eye drops, and there's pills. First, let's look at the nasal sprays and eye drops. Those are super easy to have, super common. Great news, they're okay for kidney patients. Yay! Love that. Now, eye drops, there's tons of brands out there. This one happens to be Clear Eyes. I use this. I use Visine Allergy. They make an allergy version of it. It's great. Just drop a couple drops in there and your eyes will clear up, not be bloodshot, and that swelling will go away. It's also a little great as a preemptive thing. If you know there's going to be something like getting ready to go out on a walk and the grass has just been mowed in your neighborhood, that could help. I keep these bottles everywhere. I have them in the car. I have them at my desk here at home, my desk at work, in my bathroom, in my travel bag. Don't forget, have some for when you travel so you go places. Now, when it comes to nasal sprays, similar to eye drops, they're nearly instant at clearing you up and helping, or to start helping. I use this as a prescription one. It's pretty much Flonase. My doctors gave me a prescription to it. Each nose within seconds, maybe 10 seconds at the most. Any congestion starts clearing up. Kind of smells like roses. There's a nice little smell. These have gotten so much easier. They're not the kind you gotta spray and snort up in there. These you just kind of spray and it stays up there and it sticks. Now, it's a prescription, so it's gonna cost you a bit more. If you get the Flonase version, which is over the counter, it's gonna cost you a bit more too. And sometimes you may not have those laying around all the time. When I travel, I forget those all the time. I use Afrin. Now, Afrin's great at clearing you up. Now, it's one of those ones you gotta squirt and snort to get it in there and do its trick. But you gotta be careful with Afrin. It's not gonna hurt your kidneys, but it could hurt your nose. And we're already fighting enough problems with kidney disease. We don't need nose problems also. So this is good as an occasional one to help clear you up if you've got allergies, if you don't have Flonase or you don't have a prescription with you to help you. It's a good one to run to. I also, if I have any kind of congestion, I travel a lot, I give myself a squirt each nostril before getting on a plane. I actually suffered once the loss of hearing you get when you have a congestion and the change of altitude, the air pressure and all that. I got so messed up. It was so painful once. I lost my hearing for several days, could barely hear. So now if I have the slightest sign of congestion, or if I'm going somewhere like LA where there's all that smog and it just messes up my sinuses and my allergies, I definitely use a little Afrin for that. But be careful using it long term or using too much because it can damage your nose. Now let's talk about the pills that are very common. So most of them, here's more good news, are perfectly fine for those with chronic kidney disease. But I'm going to give a few warnings in just a couple moments in this video that you need to hear before you run out and start using anything. Now, when I was in the hospital, they gave me Claritin. And that is what I've stuck with. I've stuck with Claritin. I use a knockoff, the Walgreens version called Wallatrin. You can use any version. You'll save some money. You don't have to buy the name brand. Claritin is not going to sponsor me ever. That's okay. Buy the name or the non-name brand and save yourself a little bit of money. Claritin has loratadine in it. That's the actual medication that's in there. So just look at the labels and see if that's in there. It's what my doctor prescribed to me, and I have stuck with it, and it is perfectly safe for chronic kidney disease. Now, there's some pills that are not exactly perfectly safe. Zyrtec is one of those. Now, if you ask Zyrtec, they're going to say, yeah, it's safe for those with chronic kidney disease that have a GFR over 50. You'll be like, huh, what? Yeah, if your GFR is 50 or lower, your doctor is going to tell you to not take too much Zyrtec or completely avoid it. When I hear things like that, like, yeah, maybe you should avoid it, I avoid it. My goal, get better. Not do things that could hurt my kidneys. And when it comes to Zyrtec, it's one I personally say no to. A third common one that's popular is Benadryl. Now, Benadryl is perfectly fine for people with chronic kidney disease, but it can cause some retention in your bladder. So it's going to be hard to pee. It's going to keep sitting there holding water. And if you have any kind of infection in there, it is possible, though unlikely and rare, but it is possible that infection could travel up to your kidneys. So watch your peeing if you do take Benadryl. If you're having some problems and it's not coming out, just cut back, give it some time, and it all should be perfectly fine with you. Now, 3 more points I want to make when it comes to picking your allergy medication. And this is why it's important that you stayed with this video instead of just hearing the first beginning and jumping off. Always read the label. Check what's in there. Sometimes there's these combo drugs where it'll have the antihistamine in there and it'll have something else, maybe something to help with the headache, some ibuprofen. So you want to stick with things that are true to here's what they are. Avoid those combo pills that include a pain reliever and other stuff. If you need a pain reliever in addition to your allergy medicine, take a separate pain reliever. Avoid these combos. If you don't need something that's in there, you don't need to be taking that extra stuff, and you definitely don't need any of the ibuprofen or any of that stuff that can harm your kidneys. Also, some medications can raise your blood pressure. High blood pressure is very bad for your kidneys. It's going to cause inflammation. It's going to reduce your kidney function. Now all of a sudden, toxins and waste are building up in your blood. Keep your blood pressure under control. And hopefully most of you have a 130 or 80 or better blood pressure with or without your medication. It doesn't matter, but you got it under control. So be careful. Ask your doctor, is this one going to raise my blood pressure? Is this one okay? Also, it may interfere with other medications you're taking. So again, ask your doctor. Now, speaking of asking your doctor, that is a huge, huge thing. Always, if you're taking a pill or any kind of medication or you're changing your diet, ask your doctor. Go to your health team and ask them, is this safe? Is this okay with me? Okay, we can't be messing around with our kidneys. We've already got enough things to work on. Let's not make things worse and lower our kidney function, increasing inflammation, none of that stuff. We don't need it. We want to get better. So always, with any pill, doesn't matter, vitamin, allergy medicine, doesn't matter. ask your doctor. And don't be thinking, oh, but it's over the counter and it's FDA approved. Oh, that FDA approval don't mean jack, okay? They've approved a lot of things that are killing people, that had to be recalled. There's a whole process to get things approved and take back corner shortcuts and all this stuff. FDA approved does not guarantee safety, and neither does over the counter. So be careful. You know, I'm stressing this a lot. It is critical. Always check with your doctor. And once you ask your doctor what allergy pill to take and they tell you whichever one it is, doesn't matter which one it is, but when they tell you, now you know for next year and the year after and the year after. You're not going to be going constantly asking them. You're just learning in the beginning, what can you take? And they also may say, hey, you can't take that one at this stage, but at the next stage, you can ask them again, can I now start taking that and find out if it's good for you? You are your strongest advocate. You are the one that wants yourself to get better the most. So you need this information, push your doctors and ask them. So let's summarize it real quick. Most allergy medicine is perfectly fine. Eye drops, nasal sprays, very easy to use, very quick. Pills travel through your kidneys, so we want to make sure that your doctor has said they are okay. They're not going to interfere with other medications. They're not going to raise your blood pressure. They're not going to cause any other issues. Always check with your doctor. And, you know, you should be fine having a medication you can rely on, either one, two, or all three forms of it, to manage your allergies so that you can go outside, breathe, and not have all those problems and all that constant sneezing that happens when your allergies get out of control. All right, one more time, if you haven't subscribed to my YouTube channel, click the subscribe button below and click that little bell icon. That way you'll get a notification every time I upload something new. And that way, you can get access to it. Why wait and stumble upon things when you can find out, hey, James just put something new on. I try to do it every week, a new video. Hopefully it's going to get even faster now that I got my new studio up and running. And if you know anyone with kidney disease, who lives with someone with kidney disease, who knows a friend who has kidney disease, please share my videos. Let's get the word out there. Let's help my channel grow. As it gets bigger, I can go to more doctors and get them on camera. I have a lot of them said, hey, when you get 10,000 subscribers, come on back. I'll talk to you on camera. That means we can get more great information completely free, straight from the people who should know it the best. Now, remember, I'm not a doctor. I'm just sharing with you what I have done as a kidney warrior, kicking kidney disease's butt, getting better from stage 5, 4, and now stage 3, on my way to stage 2. But I'm sharing with you what I have done, my experience, what has worked for me. It may not work for everybody, but at least it can show people, yes, it is possible in some cases to get better. When I was diagnosed, my nephrologist told me I had, quote, 0 chance. GFR 15 was as high as I was gonna go. Boy, I'm so glad she was wrong. She was so wrong. That was about 7 months ago. I am now into stage 3, looking better, feeling better, have all my energy. As a matter of fact, I am healthier today than I was even 2 years ago before I had kidney problems, because it made me change my life and change my diet. I'm now getting healthier, losing weight every day, and just feeling fantastic. And everyone deserves that. All right, thanks for watching. I'll see you in the next video.